You know that unsettling feeling when a fever starts to creep in, that subtle shiver or sense of warmth hinting that something is not quite right with your body. For someone living with chronic obstructive pulmonary disease, or COPD, a fever is much more than just a discomfort or a passing inconvenience. It is a critical signal that demands your immediate attention and careful consideration. Understanding when this signal means a hospital visit could be vital for your health and well-being. To get straight to the point, if you have COPD, a fever reaching 101 degrees Fahrenheit or 38.3 degrees Celsius or higher is a significant warning sign. When this fever is accompanied by other worrying symptoms like a sudden and noticeable worsening of your breathing difficulties, a significant increase in the amount of mucus you are producing, or if you start to feel confused or disoriented, it is often a very clear indication that you need to seek hospital care without delay. Do not hesitate or wait for these symptoms to escalate further. The reason a fever is so serious for COPD patients lies in the condition itself. Your lungs, already compromised and working much harder than they should, are less equipped to effectively fight off invading infections. A fever signals that your body is actively battling a bacterial or viral infection, such as pneumonia, bronchitis, or even influenza. These infections can very rapidly overwhelm your already delicate respiratory system, triggering a severe flare-up or exacerbation of your COPD. This situation requires specialized medical intervention that can only be provided in a hospital setting, where doctors can quickly diagnose the specific cause and administer powerful treatments to help you breathe. So, how exactly do you make that crucial decision about when it is time to head to the emergency room? Beyond the specific temperature threshold we just discussed, you must pay close attention to other critical and evolving signs. Ask yourself, is your shortness of breath becoming significantly worse, even after you have used your prescribed rescue inhaler? Are you producing a lot more mucus than usual, or has it changed dramatically in color, perhaps to a yellow, green, or even brown hue, or become much thicker? Are you experiencing severe, uncontrollable chills, feeling unusually weak or fatigued to the point where simple tasks are difficult, or are you becoming confused, drowsy, or disoriented? Be especially vigilant for any bluish tint to your lips or fingertips, known as cyanosis, which is a strong indicator of dangerously low oxygen levels. A significantly rapid heart rate that does not calm down, or if your regular home treatments and medications are simply not providing any relief, are also urgent indicators that you need immediate professional medical attention. Above all, trust your instincts. If something feels profoundly wrong, or if you are genuinely worried about your condition, it probably is a serious situation. It is incredibly helpful to know that many individuals with COPD work with their doctors to develop a personalized COPD action plan. This written plan is a valuable tool that clearly outlines specific steps to take for mild, moderate, and severe exacerbations, including precise instructions on when to contact your healthcare provider or when it is essential to go directly to the emergency room. Adhering to this plan can make a tremendous difference in outcomes. Remember, bacterial infections are very common culprits behind these fevers and worsening symptoms in COPD patients, and these often requiring prompt antibiotic treatment. This type of targeted, effective treatment, along with respiratory support, is most quickly and safely initiated in a hospital environment after a thorough diagnosis. Recognizing these vital warning signs and acting swiftly by seeking immediate medical attention is your absolute best defense against severe complications associated with a COPD exacerbation. Taking quick action not only helps manage the immediate infection and its effects on your breathing, but also significantly safeguards your overall long-term lung health and quality of life. By being prepared and knowing when to go to the hospital, you ensure you receive the specialized care needed to recover effectively, stabilize your condition, and continue breathing easier for the future.